In this video, we're going to look at some myofascial exercises to help release restrictions in our armpits. You might not give much thought to your armpits generally, but they are actually very important anatomical structures. They are the point at which your arm joins to your trunk and your shoulder. They are a structure through which a lot of vessels travel, so the arteries and veins for your arms, also the nerves for your arms, and they are a joining point of a number of muscles in the body. Anatomically, they have 5 borders to them, so the armpit affects the back of your body, the front and the sides. So generally, armpits work fine and they allow movement in your body by allowing your arms to move freely and to allow blood flow in and out of your arms. Sometimes, however, restrictions can form. And when this happens, this can start to compromise some of the structures within the armpit. So this can result in a reduction in the range of movement. It can start to pinch on the nerves and to affect the blood flow. And all of these are generally felt in your arms. So a lot of the symptoms for conditions such as RSI, repetitive strain injury, can in part be due to restrictions in your armpits. So it's a good idea to do exercises to help to free things. This gives you better range of movement. It helps to relax your shoulders and it can take pressure off not only your arms but also your neck, your chest and your upper back. So the exercises we're going to do will all help to start to release and free up this area. In this exercise, we're going to do a side stretch. So there are many ways in which you can do side stretches, and I'm going to start with just doing a seated one. So to do this, I'm going to bring my arm up over my head, and then I'm just going to tip my body to the side. Now, depending on how much range of movement you have in your arm, this may be comfortable or it may not be. If you find this difficult or it's painful for your arm, then I will show you different ways in which to do this side stretch. So for example, you can do the side stretch over some pillows or over a Swiss ball. And you can also do it as a standing exercise. So as you're here, just allowing time for the tissues to start to release and let go. The longer you're in the stretch, the more you'll start to feel things softening and releasing. So you may feel this mostly in your side or in your upper arm or in the armpit itself. So wherever you feel it is fine, that's where your body needs to release. And as this is a myofascial stretch, you need to be in the stretch for at least a couple of minutes to allow time for the tissues to release and let go. The great thing with myofascial exercises is you just do them once, but you keep going and allow the stretch to progressively develop and deepen. So we're going to come out of this stretch. Give your shoulders a little roll. And then we'll do the same stretch on the other side. So again, bringing your arm up over your head. And then just tipping your body to the side. Let your head go heavy. Let your arm relax over your head. And just breathe into the stretch, allowing your body to soften and release. And as I've said before, if doing the stretch like this is uncomfortable for you, then you can try other options. And while you're here, just noticing how the tissues feel as they start to release and let go. With a myofascial stretch, you never have to take the stretch into the end of range of movement or as far as you can. You just take it until you start to feel some resistance in the tissues, and then you wait. And you wait for a sense of the tissues starting to soften and let go. And the longer and more gradually and gently you do the stretches, the more lasting benefit you get as the fascia starts to release and let go. And as the fascia releases, then everything that's contained within it can also release. So that's your muscles, your blood vessels, and your nerves. And then we're just going to come out of this stretch. And you can give your shoulders another little roll. In this exercise, we're going to do a stretch for the front of the chest. So the easiest way to do this is to use a door frame. So any convenient door frame will do. And I'm going to place my hands on either side of the door frame. And then I'm going to just take a step through. So it doesn't matter which leg leads. And when you do this exercise regularly, you can just swap legs each time you do it. And you go through the doorway and allow your body just to relax. So my body weight's starting to drop forwards. And I can feel a stretch across the front of my chest. So you go forwards as far as feels comfortable for you. And as soon as you start to feel any restriction, then just wait and allow time for the tissues to start to release and let go. So as long as you're here for at least a couple of minutes, then the fascia will be starting to release and relax. And stretching and releasing across your chest muscles allows the front of your armpits also to start to relax and release, as it's the chest muscles that form the front part of your armpits. So you can do this stretch by placing your hands in different positions on the door frame. So maybe higher or lower. And when you do this, you'll feel the stretch in different parts of your chest. So it's good to experiment just to find which area of your chest benefits most from the stretch. And as long as you're here for at least a couple of minutes, then the tissues will have time to start to release and let go. In this exercise, I'm going to do a stretch for the back of the armpit and upper back. So to do this, I'm going to bring my arm across my chest and then interlink the other arm on top. So only do this as far as feels comfortable, so you're not trying to pull your shoulder or your arm round too much. And you'll start to feel a stretch that goes round the top of your shoulder, the top of your armpit, and into your upper back. So this helps to stretch out the muscles that attach into the back of the armpit and form that. And also will help to improve range of movement in your shoulder and in your shoulder blade. So as you're here, just allow time for the tissues to start to release and relax, and get a sense of things softening and letting go. So you may feel sensations around the top of your shoulder and your armpit, or perhaps elsewhere in your body. So wherever you're feeling it is fine. Just allow things to release, and as long as you're here for at least a couple of minutes, then the fascia will be starting to let go. And then we're going to come out of this stretch. And then we can do the same on the other side. So again, bringing my arm up across my chest, and then wrapping the other arm on top, just to create a stretch that I can feel round into the back of my shoulder, the back of the top of my armpit. So the muscles here that form the back of the armpit are quite strong. They also form the back, and they extend right the way down your back to the lower back. So sometimes when things are tight around your armpit, you can get referred pains that can travel down your back, and you might feel elsewhere in your body. So as you're here, just allowing the tissues time to release and relax. Again, making sure that you're here for at least a couple of minutes to allow time for the tissues to start to let go. And as these tissues release, they can take some of the pressure off the structures that pass through your armpit on their way down into the arm. So sometimes people who develop RSI type symptoms can do so because the structures in the armpit have become compressed. So in particular your nerves and sometimes also your blood vessels. Just allowing a sense of the tissues releasing and softening. And then we're going to come out of this stretch. In this exercise, I'm going to use a myofascial ball to work on the side of my armpit. So you can do this exercise either lying on the floor or on your bed, or you can do this against a wall, whichever is most comfortable for you. So the area that you want to place the ball is the side of the armpit, and if you feel here, you will feel the edge of your shoulder blade. And so that's where you want to aim to place the ball. So lying on the ball, you can have your arms stretched out in front of you or above your head, whichever is comfortable for you, and you can use a pillow to support your head. So this just means that I can relax my body and allow the tissues to start to soften underneath the ball. As you're here, you'll get a sense of the tissues almost melting around the ball. You may sometimes feel some points that are a bit tender. Those are trigger points where the tissues have become stuck or knotted together. And when this happens, this can be the cause of pain and other symptoms that you may feel. So working here with the ball just allows time for the tissues to release and let go. This can help to improve range of movement in your arm and your shoulder, as well as reducing pain and other symptoms you may have. So as with everything myofascial, as long as you're here for at least a couple of minutes, then your tissues will start to release and let go. If lying here on your side on the floor is uncomfortable, you can do this on your bed, or you can do this in different ways. So for example, lying on your back, or you can do this leaning against a wall. So now we can try this on the other side as well. So again, I've got the ball on the side of my armpit, and I'm going to use a pillow just to rest my head. This just makes sure that I feel comfortable and I can just relax my body around the ball. And just waiting here for a couple of minutes for a sense of the tissue softening and releasing. Sometimes as fascial restrictions release, you get a little peak of pain that then just fades away as the tissues soften. And just noticing how this feels. When you work with the ball here, you can move the ball to different points on the side of your armpit, particularly if you feel that some are more tender than others. And so you can work to release any restrictions you find all the way down the side of your armpit. And just making sure that you're here for at least a couple of minutes to allow time for the tissues to relax and let go. In this exercise, I'm going to use 2 myofascial balls on my upper back. So to do this, I'm going to lie on the floor, and I'm first of all going to put the balls into a bag to make sure that they stay together. Otherwise, they may just ping off when I lie on them. With the balls in the bag, I'm going to place them on my upper back so that the dip between the balls is over my spine and I'm not putting pressure on the bones in my spine. So the area that you're aiming for is between your shoulder blades. So when you're here, you can use a pillow like I am to support your head, if this feels more comfortable, or you can try this without a pillow, which will give you a stronger stretch over the balls in your upper back. And you can have your knees bent or your legs flat, whichever is more comfortable for you. So by releasing here, this helps to release some of the tension in the back of the armpits. So the muscles in the upper back form the back of the armpit, and if they become tight, this can start to create extra tension inside the armpit itself and compress the structures in there. So releasing here allows the tissues, the muscles to start to soften, decreases the tension, and this means that your armpits are looser and less restricted. As with a lot of the other exercises that we do, this helps to improve the range of movement in your shoulders and your arms. It helps to free shoulder blades that may sometimes become stuck down. And so generally, releasing round your upper back, your chest, will help to increase movement and help to reduce tension in your armpits in particular. So as long as you're here for at least a couple of minutes, this allows time for the fascia and the muscles to start to release and let go. If you find that lying on the floor to do this is difficult, you can do this on your bed, or you can also do this exercise against a wall.